Hi there, you're welcome to DemiRx Cure channel where we talk about medications and how to use them properly. If you're new to our channel, make sure you hit the like and subscribe button down below. That way you can get alerts anytime we post our other educating videos and contents here on our YouTube channel. And also you'll be able to help support our community here at DemiRx Cure. So what is our medication of choice today? Our medication of choice today is known as Finasteride, which is also known as a brand name called Proscar. So Proscar is known as a medication used in treating patients who have a benign prostatic hyperplasia, which is also acronymed as BPH. It can also be used to prevent prostate cancer in patients, as well as used in treatment for hirsutism. Also, a patient can use another form of the medication, which is called Propecia, in patients who are experiencing male pattern baldness. So usually in patients who are using it for male pattern baldness, those patients usually take that medication in a 1 milligram tablet daily. And patients who are using it for the rest of the other treatment I mentioned earlier are usually on the 5 milligram dose once a day. So this medication does come in a 5 milligram dose, and it also comes in a 1 milligram dose as well. So what are some of the side effects of this medication? So the side effects include depression. So patients may experience some depression while taking this medication. Also, it can cause some erectile dysfunction as well as decreased libido. It can also cause male infertility in some patients. So these side effects are not all inclusive. Some patients may notice this, some patients might not. You just kind of have to weigh the risk and the benefit and, try to take the medication to see if it'll help and be effective for what it is being used to treat. So what are some serious side effects that you want to make sure that you're reaching out to your doctor for as soon as you start feeling those side effects? So if you start noticing a decrease in your semen, then you want to make sure that you're reaching out to your doctor immediately. If you start noticing like a decrease in your sexual drive or desire or erection, then you want to make sure that you're raising those concerns to the doctor. Also, if you start noticing any breast tenderness, lump, or nipple discharge, then you want to make sure that you're reaching out to your doctor as well in order to make sure that they're ruling out any condition that might be accompanied with this side effect or symptom. And that way, they're able to tell if it's directly from the medication or see if there are other alternatives that you can use depending on the treatment. Or if you see changes in how much you urinate, then you want to make sure that you're raising these concerns to your doctor. That way they can help clarify if you need to be taking another medication or if they would need to stop that medication as soon as possible. All right, so in patients who are pregnant women, this medication these patients should avoid handling those medications as it may affect the male fetus. Also, this medication can cause impotence. It can also cause ejaculation disorder. It can cause erectile dysfunction as well as reduced libido in patients. Usually, patients that I've seen taking this medication are usually in a much older or elderly range, such as patient above 50 years of age. So, these concerns might not be much of a big deal in those patient population, but just so you're aware of what to look out for while taking the medication. Also, make sure that if you do notice those breast changes, as I said earlier, like a lump in your breast or a nipple discharge, then you want to make sure that you're reaching out to your doctor as soon as possible. For patients that are using the Propecia tablet in order to help with any alopecia or hair loss or male pattern baldness, then this medication may take up to 3 months or longer before patients start seeing improvement in the hair growth. So make sure that you're on the lookout for that. That way you're not expecting a sudden change in the hair growth. It kind of just takes time before you start seeing, a huge improvement in those hair growth. So for patients who are using this medication for male pattern baldness or patients that are using this medication for a prostate problem, this medication does not cure that issue. So if patients does stop if patients does stop taking the medication, they might start seeing those symptoms of the prostate issue resume, or patient may start losing the new air that have grown. So this is a medication that you probably have to use for a longer period of time. That way you can keep up with the effectiveness of the medication. Also, some men have noticed infertility while taking this medication. So if you're a man or of a fertile age, or you still hope to father a child, make sure that you're discussing this with your doctor before starting the medication. That way they can weigh the risk and benefit of this medication and try to see if there are other appropriate medications that you can use for this condition that doesn't affect that fertility. All right. I hope I was able to help in terms of what to look out for while taking this medication. If you have any questions or concern, feel free to leave a comment down below. You can also consult privately with a pharmacist at www.demiarxcare.com. Thank you for watching. And if you've not yet done so, make sure you hit the like and subscribe button down below. That way you can help our community here at DemiRxCare, and also get alerts anytime we post any other concerning videos or educative videos such as this on our channel. Thank you, and thanks for watching.